Okay, so as far as medications go for familial hemiplegic migraine, I will just say everyone is different. You're going to have to find your own cocktail that works for you. There is no magic set of medications that everybody goes on and that's the thing that cures everybody. You have to understand that there are 4 different genes that have been identified in this disease, and the combination of how those have been damaged is your flavor of that particular, of FHM. And so it can be very difficult to find the right combination of medications. I can say that I am extremely lucky that the medications that I've had have worked tremendously for me. So initially I was put on Keppra to control the seizures, acetazolamide to control the, the buildup of carbon dioxide and to help the carbon dioxide release from my body, and then an abortive of just ibuprofen. It's amazing, but it's just ibuprofen. It's high doses of ibuprofen, 1 Benadryl and a Reglan, all at the same time. You take the ibuprofen, the Benadryl, and the Reglan all at the same time as your abortive, and it pretty much, it'll knock you out. I mean, you will just fall over and go to sleep for long periods of time, but you'll feel better when you get up. So that's the important part. I can just say, out of all the list of medications, just try your options. Find a doctor that will work with you and try all the different options to get yourself feeling better. Be patient. It is going to be a long time. It is going to be a lot of trial and error. I would say, consider writing down how this medication is going, what's happening, what's improved, what hasn't improved. Give your doctor some good feedback on the medications that you're on. Also, it's recommended that you stay away from triptans like Imitrex. I know for me personally, I was put on Imitrex. I had a major FHM attack that was very severe. I had severe memory loss from it. It felt like I'd had a stroke. It took me months to recover from it. So be very careful about Imitrex and the triptans and getting on those. I know some FHM patients say that it works for them. It's just a huge risk. With the risk of having a stroke, it can actually cause a stroke. I'd be very careful about that. I would definitely consult a doctor before you go on that, and make sure that your doctor understands that you have FHM. Also, some other anecdotal things like birth control can increase your attacks. That can affect it. I know that we were trying to control other diseases like fibromyalgia that I have with different medications, and those reacted with everything. I seem to react with every medication. So it's kind of tough to control other diseases as you're trying to control your FHM. Just be patient and try to find what works, and be quick to identify those things that don't work.